Hello. Welcome to the Dr. Dean Show again. And today we're going to be looking at various types of therapies that we use a lot in our work with counseling with kids. So today's show is about kids and counseling and the types of therapy. And we have a very special guest today that we're going to be very excited to hear from.
Dr. Dean Beckloff has been working as a counselor with students, families, kids, and teens for over 40 years. As the founder of the Beckloff Behavioral Health Center, Dr. Dean focuses on children and families that need a little extra help via counseling. Each week with Dr. Elizabeth Zach, we discuss all things family related to help people create the positive family they want to build. Welcome to the Dr. Dean Show.
All right, today we have a very special guest who is always here. Dr. Elizabeth Zach is going to be our guest today to talk about the various kinds of therapies that are out there for kids. And really, a lot of these therapies are also for teenagers and also for adults as well.
Sure.
Yeah. Dr. Zach is one of our licensed psychologists at our clinic, Beckloff Behavioral Health Center. She is involved in a lot of different aspects. She's our clinical director at the clinic. She's also is involved in the psychological testing that we do with kids and with adults. So she has an amazing amount of knowledge about working with families, working with kids, working with adults, and so we decided we were going to pick her brain today. So we're excited to have Dr. Zach. And if you want to know more about our center, you can go to www.drbeckloff.com. Again, that's www.drbeckloff.com. And you can also pull up a lot of our video podcasts there as well. So, Dr. Zach, we are talking about different types of therapy for kids. And, I've heard of terms like CBT, ACT, DBT, EMDR, play therapy. And I think a lot of our folks have probably heard those terms as well. So, aren't they all just the same thing, therapy of some sort?
They are all therapy of some sort. So the simple answer is yes and no. So, if you kind of think about some of these different modalities,
Mm-hmm.
almost like teaching
Yeah.
styles.
Oh, okay.
So, depending on the child or adult's needs, we may tailor the approach based on, their particular concerns.
Exactly.
Yeah,
Oh, okay. That makes sense. Because I'm an old teacher. I
there
used
you
to
go.
be a teacher.
You
So,
did. You know how
um,
individuals are different.
So the one that I hear about always and forever, even back when I was working on my doctorate, um, CBT. CBT. Uh,
Cognitive behavioral therapy.
Thank you. Cognitive behavioral therapy. And that's one that seems to be something that people put out there quite a bit.
Right.
What is it? Why do people put that out there quite a bit?
One, I'll say it's empirically validated, meaning it has been shown, right, to be an effective form of treatment,
Oh, okay.
based, backed by research. I think I particularly love CBT because it's really based on a simple idea that cognition's thoughts, feelings, and our actions, our behaviors are all interrelated. So we can, work on modifying thoughts, which can impact how we feel. We can work on modifying actions, which can impact how we feel. If kids, I like to use the example when I'm talking to parents about how the type of therapy works. If kids have a thought that all dogs are ferocious, they're scary, they bite, they're bad.
Which is a scary thought.
Absolutely. So
Yeah.
if they're walking with their parent to the park and they see a dog, what's going to happen? They're
Right.
going to feel anxious,
Right.
right? They see the dog and they're anxious because all dogs are ferocious. So we help the kiddo learn that some dogs may be ferocious, but not all dogs. And this particular dog is on a leash. It's wagging its tail. It is kind of happy looking. And so they
And probably
learn,
on a leash.
and it's on a leash.
Yeah.
And so, just by changing the thought that all dogs are scary and bite, some dogs may, but many dogs are family pets and are okay. And they learn that, they can tolerate seeing a dog on a leash.
I think they just need to watch All Dogs Go to Heaven.
Maybe so.
But that is a way of introducing to a kid, for example, okay, my daughter, she was my oldest daughter. I'd taken her down to the park. She was probably maybe 2, maybe not quite 2, and there was a duck. Oh my word. She was excited, jumping up and down and, kind of flapping her arms too and jumping up and down. Well, the duck, we found out later, was a duck that other kids had been
Hmm.
throwing rocks at.
Aw,
So when my daughter did that, it charged her and it knocked her to the ground, jumped on top of her, and started pecking at her face.
not good.
I'm watching this.
Now all ducks are ferocious and terrible and
Well,
scary.
I'm gonna get to that. So I had to run over, kick the duck off, grabbed her. She's of course crying. I took her home. At that From that time on, anything that moved that was alive, she was
Mhm,
petrified of
mhm,
for a while.
mhm.
Yeah, yeah.
It becomes generalized, right?
Yes.
And so then we help the child learn how to kind of shrink it back down.
Okay.
And we may teach, we call them, cognitive distortions or thinking errors,
Right.
or, helping a kid almost be a thought detective. Is
Yeah.
this a true thought? Is it a trick thought?
Right.
Is it something that we've kind of overgeneralized and we need to, shrink back down? So I
Right.
think it can be a really powerful
And
modality.
these experiences can happen with young children, they can happen with adults.
Yeah.
And so that's where I guess this CBT comes in and is helpful. What in particular might be
Mhm.
helpful with CBT, cognitive behavioral therapy?
I think it works really well with, again, to your point, adults or kids who are struggling with anxiety, who are struggling with depression, who may have, consistent kind of negative thinking patterns,
Okay.
kind of helping them really um, sort of just shift gears a little bit, think
Yeah.
of things in a little different way. And also actions, right? Things that they can do behaviorally that can be helpful. Deep breathing,
All right.
other kinds of things with they're starting to feel anxious or if they're starting to feel sad.
Right.
Hmm.
Um, the next one that we're going to look at is one that I'm drawn to. There's theories out there, and when I was in graduate school, they really wanted us to pick one that seemed suitable for us, that would make sense. This one makes sense to me. I like it. I think highly of it, and it's called ACT. Um, it's acceptance and commitment therapy. ACT. So what about that one?
Hmm.
What's that one about?
So ACT is what we're talking about, and it's a little bit different than CBT. So now we're looking at instead of trying to change their thinking pattern, we're really moving toward accepting the thoughts. We all have thoughts that pop in our head,
Yeah,
and learning to kind of tolerate the thought, learning to tolerate the feeling, accept the thought, accept the feeling,
okay.
almost like we don't have many clouds, but almost like recognizing, or thinking of the thought as a passing cloud and just letting it pass without getting stuck and kind of hooked by the thought or the feeling.
And that thought and the feeling, are you referring to, like, if somebody has a a great fear of tornadoes and they see a cloud,
Mhm.
that might be the cloud might be a trigger for them to
Mhm.
think, "Oh my word, we're gonna have a tornado."
Mhm.
So, what does this kind of therapy do?
So this would be helping the person recognize, oh, I'm having the thought that there might be a tornado. It's just a thought. Oh, this is my worry thought about storms.
Because it's just a thought.
It's just a thought.
Yes, makes sense.
Yep,
Yeah,
yep. I think it's nice in that, again, we can't always control our thoughts.
absolutely. Right.
And, we help them just notice them, make space for those uncomfortable feelings. Again, we're not just focused on thoughts, but even the feelings that there's times we may feel anxious and those feelings will pass. That sometimes it's not getting rid of the thought or the feeling.
Okay.
It's just making room for them, that they will pass, just like clouds pass,
Right.
weather passes.
So this particular approach, and there is a lot to it. There is a lot to
Well,
it. I
and
know.
and I think we probably should should back up a little bit and say we are just hitting the highlights of all of these different modalities. I mean, we
Right.
could spend multiple podcasts on just one. And
Right.
so we are really just skimming the
Giving an
surface.
overview, but if you do see some of these terms like ACT or acceptance and commitment therapy, then maybe this will give you a little idea of where we're
Mhm,
headed. Now, in terms of this approach,
mhm,
what is it helpful for when with regard to kids or even adults?
mhm. I use this approach when I have clients that are stuck in that rumination. They're overthinking, overanalyzing,
And I
um,
think everyone knows we do that. As human beings, we overthink.
getting stuck in their worry,
Mhm.
right?
Right.
Helping them get unstuck. I think it can be helpful with folks who struggle with that perfectionism. And this one also, we didn't talk about this, but I love that it's also values based.
Okay.
So it's y you know, working not only toward, maybe what their goals are, but what their values are.
Right.
Sometimes I have an adult client that I'm working with right now who is always thinking of the next promotion, the next job, the next, next step, and so he's very goal focused, um, but he's kinda missing out on other things that are important in his life, his values. And so really looking at, are we moving toward our values or are we kind of getting stuck and sidetracked and doing things that maybe aren't in line with our
Okay,
values?
you just helped me. That's fantastic. Yeah,
Yeah.
because I think, people say this all the time, but being goal oriented can be a good thing. Let's move
Yes.
towards our goals, but
Yes.
then
Yeah.
you may be missing out.
Yeah.
FOMO,
Yeah.
fear of missing out.
I love there's a video that one of the authors, that's very involved in ACT therapy, has on, YouTube that I use for a lot of my clients. It's 2 kids riding in a car, and they're both, the goal is they're getting to Disneyland's, you right? So they're very excited to go to Disneyland. One kid is, doing the, "Are we there yet? Are we there yet? Are we," "How much longer? Are we there yet?" And the other kid is also wants to get to the goal, wants to get to Disneyland, but he's enjoying the scenery. He's playing car games, license, all that kind of stuff. And so they both ultimately get to the goal, but one has had a lovely drive and the other one has, just stuck on how much longer.
That's me. That's what I do. When I drive, I am just focused on getting
Getting
there.
there and you're missing
And
out.
because of that, on my way back from Oklahoma this weekend, I got a ticket. So there you
There
go.
you go.
Gotta just take time,
Just
get in with your values.
right.
Yes.
Yes.
And enjoy the journey.
Enjoy the journey. That's
Yes.
it. That's it.
Well, let's move on to another one that's, you know, you hear a lot about, and I know you've done a lot of study and work in this particular arena, but it's another one that I love. This one is called DBT, dialectical behavior therapy, and it's getting out there. I've had um, folks where the court has ordered
Mhm.
a parent to to get counseling with dialectical behavior
Mhm.
therapy, and it's kind of that's a big word, dialectical, and what the heck is
Mhm.
dialectical?
Mhm.
So um, let's let's just do a little snippet of this. What is this one about?
So dialectics, really means that, two things can be true at the same time.
Oh,
I can love my children, and I can also be very angry at their behavior at the same time. They're both true. They're both true. So, where some of these other approaches may be focused on thoughts, feelings, DBT, the core of DBT, I think, is really based on skills. It's a lot of skill building. There is a lot to this type of therapy, but predominantly for folks who feel emotions very
okay.
intensely. And
And there's a lot of us out there.
there's a lot of us. And so DBT kind of has four key areas that, again, we're teaching skills in these different areas. So, mindfulness, we hear a lot about mindfulness, and really all of these therapies to some extent are looking at mindfulness, kind
Right.
of staying in the here and now, staying present, getting grounded in the moment. Emotion regulation, teaching skills in emotion regulation, teaching skills in distress tolerance. So I can feel angry, but I can also sort of manage that distress. I
Yeah.
don't have to act upon my distress.
Yeah.
And then interpersonal skills, learning how perhaps to communicate differently with a peer or a colleague or a boss.
I think my wife would like for me to communicate a little differently too, so
We'll teach you some of the
I
interpersonal
think I might
skills.
need to do that.
Yes.
And
Yes.
really,
Yeah.
all of us can always use some new skills, particularly
Yeah.
with more intimate relationships. I said my wife, that's it's those kind of relationships
Sure.
that can be impacted by maybe emotions that get too big.
Yeah. I think it's giving folks a toolbox, to manage their big emotions, to manage their learning how to, we talk to folks a lot about learning how to respond rather than react.
Right.
That, just because we have an impulse, we don't have to act upon that impulse. We can learn some skills to sort of regulate ourselves.
So, and I think you said this. So, is this for a lot of our folks? And this is true for kids, this is true for adults, particularly with kids,
Mhm.
but that impulsive
I
thing.
think it's fantastic with our kids that struggle with impulsivity, with our kids that, parents will say, my child goes from 0 to 60,
Yes.
immediately, those big emotional
Right.
reactions.
Right.
Perhaps teens who feel overwhelmed
Yeah.
regularly. I think it's a great uh, form of therapy if we're using just, the skills.
Yeah. Wow. Yeah. And of course, as we know, some people come on the planet just kind of built
Mhm.
with this. I mean, a lot of our kids, for example, with ADHD,
Right.
they have big emotions. They have impulse control issues.
Mm.
Other diagnoses out there are like that too. It's just how they've come built.
Mhm.
But something like this would be very helpful for them.
Sure.
Okay. So in terms of DBT, I think you've already answered the
Mhm.
questions. It's for big emotions,
Mhm.
impulse control problems,
Right.
and then anything else?
I mean, I think it can be used, even with parent-child problems. So if maybe a teen daughter is having high conflict with mom, I
Yeah.
think, helping them with those interpersonal skills, helping them learn how to respond to each other
Yeah.
differently. So a wide variety of things. Yeah.
This next one that we're going to take a look at is called EMDR. EMDR. There's a lot of clinicians out there these days who are trained in EMDR. I believe that there's some pretty extensive training to become
Mhm.
an EMDR trained therapist. I know that they use this modality quite a bit in hospital settings.
Mhm.
So what exactly is
Mhm.
EMDR?
This one is a little different. It's very interesting and has been found to be highly effective, particularly in trauma.
Oh, okay.
This is I think when something overwhelming happens,
Like a duck attacking you
correct,
that's bigger than you
correct,
and jumping on you.
correct.
That's
Very scary stuff.
yeah,
And the brain can kind of get stuck with replaying that image,
right,
right? Or
right.
having those memories.
By the way, she
Yeah,
has no memory of it.
that's good. She didn't need an EMDR then.
Maybe. Could have been helpful, probably. So
But there's times where we need to help a client reprocess the memory or
oh, okay.
reprocess the issue so that they don't get stuck. And it can almost be a way of filing away the memory. It's not, let's not ever think about it again. The memory may pop up, but let's learn or let's do some of these skills so that the brain can kind of file it away, maybe put it in the spam folder rather than in the inbox where it just keeps
Oh, that
popping
makes
up.
sense.
Yeah. And it's
Spam
the
folder,
spam
right.
folder, right? We
Yes.
don't have to access the spam.
We
It's
don't want it.
there. We don't
Yeah.
want it. Yep.
Yeah.
Yep. This one's interesting because it involves things like eye movements, um,
In fact, that's what the EMDR stands
eye
for, right?
movement.
Eye movement desensitization and reprocessing,
Correct.
which I
Correct.
would assume that the reprocessing part is incredibly important.
Correct. Yes, yes. And there's other kinds of ways that clinicians can use EMDR, rhythmic back and forth kind of stimulation. Again, it's reprocessing through, and I don't know all the
Yeah.
physiological
Right.
mechanisms that are involved in doing these things. But it does seem to be incredibly effective.
I've never studied much
Hmm.
on EMDR. I know that we've had therapists at our office that have
Hmm.
done study on
Hmm.
EMDR and have been EMDR trained, but I don't really know that much about it, but I do know that it's out there used quite a bit.
Hmm.
And it just makes so much sense, especially with trauma.
Correct.
Now, these days, sometimes we hear almost too much about trauma,
Mhm.
but it is there. There's a reality to trauma. And that is one of our segments that we did
Mhm.
with Michelle Rosewell
Right.
that was about trauma and big trauma and little trauma. So, a lot of times people who go into the hospital are dealing with traumatic events that took place. So, this can be very helpful, but it can also be very helpful, I think, in an outpatient basis as well.
Sure.
So,
Sure. I mean, certainly folks that like you said have had trauma, folks that struggle with PTSD, post traumatic stress disorder. It's been used in the adult population. You mentioned the hospitals, at the VA, with our combat veterans.
right.
It can be very effective in reprocessing those traumas. Yep.
Absolutely. Oh, well, we've come now to the love of my life.
Yes.
Um, I, when I was in working on my master's, I took this little course that I had never heard about, and it was called Introduction to Play Therapy. And I fell in love immediately. It is the way that we work with children. Now, there's lots of different theories and facets of that, but play therapy became a love of mine. So, what about play therapy? What is it? Have you done play therapy yourself? What's this about?
I think play therapy, like you said, is so special, especially for our younger kids,
Yes.
that may not have the words. These other therapies, are more talk therapies.
Yeah.
They require the language, and young kids, may not have the language to express painful situations. And so, they use play. They show us those internal kinds of struggles or difficulties through their play. And so, we see themes that may come out, and we're able to kind of help them, yeah, through, toys, through we have sandboxes.
Yeah.
We have puppet theaters, where, they may be able to kind of, again, express themselves, not using language, words, but yeah, through their play.
Yeah.
Mhm.
Play therapy. And we have at our office, we have play therapy rooms. I mean, we've created rooms that are for play therapy, expressly for play therapy, and we want to have that kind of setting. I think in our center that we have the best ways to access and help kids. I'll tell you one little story. I had a mom come in one time who they brought their kiddo, and um I noticed pretty quickly that this little girl, she got in sandbox and she put a bed in the box, a little girl in the bed, and then it was surrounded by monstrous creatures.
Mm.
And she played that out several times and then introduced in her story uh good positive animals and they chased the bad ones away. Her parents came in the next time and said, "We don't know what's going on, but we've always" this was not what they had brought her in for,
Mm.
but they said, "We've always had to lay with her,
Mm.
rub her back, stay with her till she fell asleep. She was anxious about going to bed, scared about going to bed." They said, "She's just been turning over and going to bed and going to sleep." So,
It's
yes,
incredible.
it
Yeah.
is a way
Yeah.
for kids to work these
Yeah.
issues
Yeah.
out in a very natural, childlike way. One of the things that we say is fish swim, birds fly, and kids play.
I love
It's
that.
just who they are. And all of you who have kids know that kids play.
Right. If adults talk to heal, kids play to heal.
Yes, yes, they do.
Yeah.
And it must be with a therapist too. That's
Mhm.
probably the catalyst here is that's where they are sharing this with another
Mhm.
person.
Mhm.
And that's extremely helpful. In terms of kids, and I could probably go on forever and you could too, but what is play therapy for? What's it great for?
Mhm. I think, really any age.
Yeah.
Honestly, I think adults don't do enough play, and you could use it, in some respects, some art therapy and different things. But really, I think predominantly our younger children, kiddos that may struggle with that emotional expression, right? This kid wasn't able to express, I feel anxious at night, to you, but was able to, express it through
Play
her
it out.
play. Yep.
Yeah.
Yep. Anxiety, behavioral concerns, trauma, again, lots of different things that I think it can be helpful for.
Yeah, and I agree with you about, it is something that is extremely helpful for younger children,
Mhm.
but it's almost a magical thing that happens with kids in a play therapy room with the therapist, but we lose it. We they grow out of that. And so now that's really hard to say because there's some kids, even teenagers who have a lot of play in them.
Mhm.
And one thing that you've mentioned, adults, there is a lot of work going on with adults and utilizing some play therapy principles as well. So it's very interesting, but we do lose a bit of that,
Right.
and we want kids to move on to where they're processing with language.
Right.
That's critical and important too.
Mm.
So, is there a way to give us a synopsis of all of this? Can
Wrap
you?
it all up in a little
Yes,
bow.
absolutely. That'd be great. Can you do that?
I can try.
Okay.
Yes. Okay. So with CBT, in a very simplified way, we're looking at changing the thought.
Okay.
With ACT, we're
That
real
ACT.
ACT, we're working on accepting the thought, not getting stuck
Oh,
in the
okay.
thought.
That's good.
Accepting. DBT, we're learning skills, skill-based toolbox, to manage, big emotions. EMDR, we're working on processing, reprocessing past trauma
In
predominantly
order to overcome it.
in order to overcome it. Yep. And then play therapy, we're looking at just expressing feelings, expressing concerns through play.
Right. Okay.
Lots of other therapies that we did not talk about, obviously, today.
Yeah.
folks may have heard of interpersonal therapy, psychodynamic. We didn't talk about humanistic, person centered, although I think we all use that,
Right.
to some extent. But those are, things that, we may have to do another segment someday.
Absolutely. Yeah. So, therapy is not one size fits all. Would you say
Correct. Correct.
there
Yep.
may be a different way to
Yep.
approach people?
Right. I think the right approach really depends upon the child's needs, their
Okay.
unique needs.
And
Mhm.
that would include the teens' needs,
Correct.
the
The
adults'
adults.
needs,
Correct.
uh, and so we want to bring about any kind of modality that's going to be helpful for the client, the kid, the parent, the adult. Absolutely. Well, Dr. Zach, thank you so much for lending us a little bit of your expertise and getting some understanding of these various types of emotions, or not emotions, ways of dealing with emotions
Right.
that we've got, therapeutic ways, counseling methods. And we will be back again and have another episode. But thank you. And I'm sure you'll be there too. Thank you for being here
Mm.
and giving us all of your expertise. Again, if you want to contact us, you can go to www.drbeckloff.com.